Prof, good evening. And thanks so much for your time. Now, a lot of people are probably going to think the advice we're giving is, obvious stuff, but we really tend to forget day to day of how to do things properly. So we're talking about preventative, the main thing being hand washing. And it surprised me to learn that not many people know how to do that properly. Yeah,
so the key really is to use soap. If you don't have soap, you can even use ash. Ash.
Okay.
And it's a matter of rubbing your palms together, lathering up, and even doing between the webs on both sides. So that we really need to make sure that we've done a good job. And then the key is, after that, is to dry your hands as well.
Should we be using like paper towels, disposables at the moment?
Yes,
rather?
Yes. I think that's the best way.
So when you say use ash, you're not using it with water. It's almost like is it a dry cleanse?
Yes.
And it works?
Yes.
Okay, I've never heard that before, so that's quite fascinating as well. So is there
But the big thing is soap.
Is soap. Is there a particular type of soap? Should we be using those properly strong,
No, it's not going to make any difference.
Yeah.
These soaps that are said to be antibacterial, really, just use regular soap and water. And we know that that's really what makes a difference. It's scientifically proven. It will make a difference not only for coronavirus, but for other diseases that all of us are carrying around, especially for young children. It can save many lives, especially children under 5 who are dying still in South Africa in this day and age of diarrhea and other respiratory conditions.
So how often should we be washing our hands?
As often as possible.
Whenever you're around other people.
Yes, and we're all touching surfaces all the time.
Yes.
So, we're opening a door, you're going to the toilet, it's constant. We've got a shared kitchen at work, those kinds of places, even touching the handle of a kettle.
Yeah, microwaves, whatever everybody says.
Exactly.
Now, hand sanitizer.
Yeah.
There's mixed sort of advice about that. Some people saying, oh, well, the hand sanitizer doesn't really work. Others are saying, but if I'm traveling, what do I do? I've got to carry this. Your thoughts on that?
Yeah, so the hand sanitizer, I think, is very important, especially for travelers. It's not so easy always to find a bathroom.
Yeah.
And the hand sanitizer must have at least 60% alcohol.
Okay.
So that really works well. In fact, in some airports, I'm told, in Kenya, for example, when people are arriving, that the airport has put hand sanitizer all across, so that people coming off planes, people who are working on the planes are all able to have something. Airports are particularly dirty places, as are aeroplanes.
Yeah, Okay, so for those people who have to travel, they can't cancel travel plans at the moment. I'm sure there's a bit of a dilemma. We try and avoid anybody who's coming from Durban at some point as well. So, what are the precautions you should be taking?
I would say, wash your hands, use hand sanitizer. Try not to touch your face. It is very, very difficult. And I think the most important message that I have for people is don't panic.
Yeah.
I think this is basically a version of the flu. It seems to be more stronger for old people, elderly.
Yeah.
And, the death rates across the globe for the elderly seem to be much higher. But actually, especially for children and young people who have normal immune systems, just treat this. This is not a panic situation.
Yeah. So that's washing your hands.
Yes.
Some people going as far as buying gloves when they're traveling now and masks. So who should be wearing those? That would be the elderly and those who are sick probably?
Well, I think it's mainly the people who are sick. It's not the people who are well. You can't really prevent that from happening if you wear a mask. The masks aren't particularly good anyway. It's probably pointless. So my advice is if you really are sick, wear the mask. We've got a situation in South Africa where there are many people with TB, and especially drug-resistant TB. We need those masks for those people, and especially the healthcare workers who are looking after them. So let's not buy up all the masks. Let's be rational in this situation.
Okay, and I suppose, yes, the big word is, like you say, don't panic, because don't overthink it also at this point, because then you're just going to be creating a whole ripple effect of people. And sometimes when you try to be too careful, you end up being careless.
Right.
And that's the other thing. What are the surfaces, like if you're in an airport or if you're in a public area, like you say, we're touching surfaces. It's not necessarily someone's going to spit at you or
Exactly.
droplets are going to land on you. So
No, so these coronaviruses, and actually many viruses, do survive on escalators, on
which we hear are the dirtiest things anyway,
Right.
coronavirus or no coronavirus, right? Yeah.
You know, rails of whatever it is, when you go on public transport. You know, there are surfaces wherever you go. Certainly in bathrooms, in kitchens. We need to take care of the things that we should have been doing for a long time. And this may actually be a wake-up call for all of us, especially in South Africa, where I think we have not been appropriate about hand washing. I think this is a real wake-up call for us.
And hygiene as well,
Yeah.
general hygiene. Okay, so it's as simple as that. Just keep those hands clean. You don't need any fancy products. And if you are generally healthy, there's no need to panic at the moment. Thank you so much, Prof. And let's hope that, people out there listening are not changing their lives drastically as well because of this.